or not. Entails efficiencies that will enable us to be able to execute a given function. So that's just the same thing in the explanation. Now, for us to do health education, we need something to do with pedagogy. Pedagogy is like the skill of teaching, the art of teaching. In other words, for us to be able to effectively discharge health education, we need to have guiding principles, how to effectively teach, effectively learning. We are given the we are given the 7 components that are quite important for us to be able to practice this health education effectively. 1, need assessment and problem diagnosis. You know, when you look at a situation, for example, you go into a community, then there are a number of diarrheal diseases. Then you ask yourself, what are the issues? Probably it's the issues of hygiene, probably it's the issues of nutrition and so forth. Then determine whether health education is the appropriate intervention. Now, you've looked at the problem, you've looked at what the people need. You ask yourself, what strategy? Among the many strategies, health education is one of them. But when we say determine whether it's the appropriate intervention, it means universally of choice. 3, issues and risk factors to be addressed. If we are looking at, for example, diarrheal diseases, what are the issues? What are the risk factors that contribute to it? Then we set the goals and objectives. What do we want to achieve? For example, we want to control the diarrheal diseases, we want to improve hygienic standards, we want to reduce morbidity, we want to reduce mortality. Then we select an intervention. Once we implement it, we evaluate as to whether we are doing well or we are doing badly. Then we can revise the plan if need be, to look at the areas that we did not do well so that we improve upon them. When you are doing health education, mostly you are dealing with adults, and therefore the principles of learning are extremely important. The principles of learning are extremely important. So I want to ask for your indulgence, what are some of the principles of learning? Sir Boniface?
Number 1, we have readiness, exercise effect, primary and recency.
What do you mean by readiness?
Readiness, so be physically, emotionally and mentally prepared.
Okay. Yeah. Learning happens if it only meets a ready person.
Yeah.
A person ready.
Yeah, and also and willing to learn to be effective.
Good.
Yeah.
So, and you know, health education is a little more unique. Now, for students, for example, sometimes you like it or not, lazima ulazimishe ingie because you must pass an exam. How about you educating a community who are not going to sit anyone's exam? It becomes more challenging when you look at those principles of learning, isn't it? Good. Okay, Julia has put up your hand. Please speak, Julia.
Practice.
Yes. What do you mean by them? Elaborate how they contribute to learning.
Learning should be consistent for remembrance.
Okay,
Yeah.
good. And
Okay, they are more of the same and repetition and practice. Hands-on skills for practice.
okay, fine. Crispin, two more.
So we are able to expound, and we came across actually have active engagement.
Yes.
Um, where we say that students do and think rather than listening and to watch. So this type of engagement deepens student learning and connects them with the material.
Mhm.
And it is that we came to find that it improved exam results. It also leads to achievement gaps by underrepresented students groups.
Oh, fine. I think that's okay. So the principles of learning are the guiding framework, and it's important that we review them. Planning for instruction. We have looked at the tasks, include assessment of needs, diagnosis of the problem, development of appropriate goals and objectives, selection of methods for intervention, implementation, the intervention, evaluation of program effectiveness, and revision of the program as needed. Now, these stages, as they are not only important for you to memorize them and put them as such. You're actually supposed to, in a practical sense, develop a plan of instruction on a particular issue following this aspect. And I'm going to give you a few minutes to be able to come up with a plan of action for a particular health need following these 7 items in this slide 173. Uh, you're going to make your own choice. I'm going to give you a number of issues for you to develop a plan of action on. So, following the 7 steps or the 7 ingredients of assessment of needs, diagnosis of the problem, development of appropriate goals and objectives, selection of methods to create an intervention, implementation of the intervention, evaluation of the program effectiveness, revision of program needs, and so forth. Use that approach to be able to create a plan, to be able to create a health education plan. I repeat the situations. In fact, I'm going to make them 5. The environmental sanitation, people are littering everywhere. There's a rampant in a village. Maybe there are many diarrheal diseases. And then you're talking to an individual who is a hypertensive and a smoker, and to a person who is obese. And then lastly, uh, to a mother with a malnourished baby. To a mother with a malnourished baby. What do I expect? I want you to come up with what are the needs of that situation? What is the problem? What are the appropriate goals to achieve in that person or in that situation? What are the intervention approaches we are going to use? How are we going to implement? Then how are we going to evaluate whether we have succeeded or not? And just if there will be any revisions required.
My name is Julie Bani, speaking on behalf of Group 1, presenting the plan of action for environmental sanitation. So the first one is needs assessment. whereby the objective is to understand the current sanitation status. Assessment is conducted through surveys on sanitation issues, intervention with community, I mean, okay, interviews with community leaders and health workers, observation in homes, schools, public spaces. The assessment also entails assessing the community's readiness for change. If the community maybe shows interest in improving sanitation, the assessment also helps us create an output plan. After obtaining the report, you identify priorities of sanitation based on population of an area. The second step is setting goals and objectives. The goal is to improve sanitation, to reduce diseases, Um, about the objectives, the acronym is SMART objectives: specific, measurable, achievable, relevant, and time-bound. Examples of objectives: you can decide to reduce open defecation by 40% in 6 months, sanitation sessions for 80% of households in 3 months, improve waste disposal by 50% in 4 months. Those are some of the goals you can set. Goals enable you to measure progress. The step 3 is developing a plan. The plan targets, or you target audience. You can target women, children, local leaders, etc. You can give key messages. Key messages: hand washing, safe to water storage, proper waste of toilet use. You can advise, plan on what to, like, once you target the audience, what to really tell them. You can even plan for the methods of communication, e.g. open discussion, posters, flyers, distributions, radio messages, school education, and demonstrations. Step 4 is resource identification. Resource identification may still be classified under planning. So, human resources, health educators, volunteers, teachers, and other trained personnel. The volunteers are for logistics and mobilization. Teachers and students are to act as change agents. Material resources, flip charts, flyers, hygiene kits for practical hands-on experience. Financial resources, you can request funds from government, partnership with NGOs, grants, and community distributors. And step 5 is implementation. Based on what you have planned, you can decide to implement by maybe launching by community cleanup day, weekly school or community sessions, home visits by health workers, engage local influencers. Yeah. The step 6 is monitoring and evaluation. Monitoring and evaluation, what indicates, or what can be used to monitor the, the people is by monitoring their attendance and their participation based on their willingness. There's knowledge, their knowledge by testing them. Maybe before implementation, you may test them. That is the pre-test. And the post-test is after you've taught them, and then you compare what they knew and what they now know. Those are the pre and post tests. Behavior changes. That is part of how the people are going to implement after the knowledge they acquire. You can observe how they use their latrines, maybe if before they used to maybe do it anywhere. Yeah. Then by follow-up surveys, by monthly follow-up surveys or inquiries, maybe if you want to inquire about the students from the teachers, and yeah. Then step 7, feedback and replanning. Feedback and replanning involves gathering feedbacks from the audience through meetings, suggestion boxes, maybe questionnaires, surveys, observations still. Adjusting strategies is part of replanning. You can decide to be, next time you be more practical, more radio programs, maybe more flyers. Maybe the information didn't reach the whole percentage of the people, and you decide to implement new ways. Then there's planned follow-ups and refresher trainings. You don't just train and go, you train and still come back, and yeah. Then conclusion, summary of plan, emphasis on community involvement, sustainable behavior change.
Okay,
This
I think for group 1, we give them a round of applause. Well done. That was good. Group 2.
Yeah, so on group 2, it's on environmental sanitation too. So we begin with the assessment of needs. First, you have to conduct surveys, community observation, interviews, and talk to local leaders, health workers in order to get the gist of what is happening in that community. For example, you should, in observation, there is water disposal, stagnant water, and how the people use their toilets. Then you can also notice how many, let's say, public toilets are there in the place and the population. Is it enough for those people there, or there's need to increase the number of toilets? Then after you've assessed the needs, you diagnose the problems, the root cause for environmental uh, and hygiene. Yeah. So the root causes may be lack of awareness, poor access to clean toilets, poor disposal systems, poor cultural habits. For example, you go to an area and you see that children are defecating in open areas, every spaces. They are prone to diseases like typhoid and cholera. Yeah, so after diagnosing the problems, you've assessed the needs, you've diagnosed the problems. Now you develop appropriate goals and objectives. Under the goals, the goal is to improve environmental sanitation and to reduce the diseases caused by environmental and hygiene. The objective, let's say here you have to make smart objectives, realistic ones. You can't say that by the end of 1 month you expect an area that was unhygienic to become hygienic. So you have to go like be realistic and have realistic objectives, such as by the end of 6 months, maybe all households should be able to know on how to segregate waste properly. And within certain months of training sessions on hygiene should have already been conducted in the area. Yeah. After you develop these goals and objectives, you select the method to create interventions. We have 3 here. Educational methods. This is through workshops, demonstrations, posters, and school campaigns. Then in communication tools, you can use the local radios, WhatsApp groups. Yeah, here in WhatsApp groups, you can entice them by even making them WhatsApp admins, and you tell them that they have the local leaders tell them they have some power in those groups. So, power entices people. Yeah. Then village meetings, dramas, and so on. Then practical tools. Here now you bring the physical aspect. If they don't have dustbins, you have to provide, like, not to tell them to buy, but you distribute the dustbins that you expect them to have. You construct the latrines and toilets that they lack, and clean up days. You implement some cleanup days. Yeah. After intervention methods, we have implementation. Here we train health educators and volunteers on environmental sanitation. Then we launch community-wide clean environment week to spread messages. You visit various homes, creating awareness on environmental sanitation. Now that we've implemented our interventions, we monitor and evaluate how they are progressing. Like, is it working or something like that? So you monitor the disease incidence data. For example, a school had reported cases of cholera and typhoid, and after the interventions that you made and implementations, there is either a decrease, or there is no change or an increase in the diseases. So you have to notice the feedback, evaluate attendance and participation in training activities, conduct surveys to assess the changes. Then here you can conduct surveys. Let's say you had given them beans. Yeah. And you are seeing that these beans are not in use. Here you now know whether these people can be taught on how to use beans effectively, or it's not working, something of the sort. After that, you review the revision of the program. Has it worked? What should we do? Should we begin another plan, or something of the sort? So here you adjust intervention based on the findings. Let's say you had given these people beans, and they are not being used effectively. Apparently, only 10% of the population are using. You opt for another method, maybe situating some beans permanently at some places, strategic places where somebody maybe finds it hard to carry the bean around, something of the sort, and still environmental sanitation is a problem. So here you can just situate beans at strategic places. Yeah, if goals aren't met, you modify the strategies. Yeah, you can't force people to do something. So you just entice them in a way that they can do it. Increase the frequency of campaigns, involve more youth and religious groups, and have places of feedback like meetings, suggestion boxes in the etc. Yeah, that's all.
Thank you, Group 2. A round of applause for Group 2. Good. The team on the environmental sanitation have done a wonderful job. Let's hear Group 3 and 4.
In group 3, I'm going to present about the diarrheal diseases. In number 1, under the assessment of needs, we have the medical assessments. You have to check on the frequency of the diarrhea, the duration in which they are having the diarrhea, and the severity of the diarrhea, or any other signs of dehydration. Under knowledgeable assessments, we have to understand the causes which might have caused the diarrhea. We have to check on the prevention methods and treatments we can administer. You also have to check on the socioeconomic factors, such as the living conditions of the people, their water supply, sanitation, and other hygiene practices. We also have to check on the risk factors, such as the poor hand hygiene, whether they are taking unsafe water for drinking, and whether they also lack access to healthcare. Under diagnosis of the problem, we have to check whether the patient demonstrates inadequate knowledge related to their hygiene or handling water or food safely, which might be contributing to their recurrent diarrheal episodes. Under health education diagnosis, we have to check whether there is risk of dehydration due to frequent fluid loss due to consistent diarrhea. We also have to check on poor environmental sanitation and how they handle their personal hygiene. In number 3, under development of goals and objectives, our goal mainly is to reduce the occurrence of these diarrheal diseases through our improved knowledge and improving their hygiene practices or changing their behavior, considering their health. We have to teach them maybe to wash their hands, to boil their water for drinking, and to seek treatment when they notice such. Under number 4, the selection of methods to create an intervention. You can choose methods like one-on-one health talks with them. You teach them how to practice boiling and maybe taking safety measures to prevent those diarrheal occasions. You can also use visual aids like pictures or posters to demonstrate the effects of diarrheal diseases or maybe the signs. You can also use demonstrations such as teaching them how to wash their hands and ORS preparation, which is the oral rehydration solution, which contains things such as glucose to retain the fluid which has been lost during diarrhea. You can also distribute flyers which are written in their local languages to enable them to maybe understand the risks of having poor hygiene, which might be causing them to have these diseases. Then under selection of methods, you can also provide them with materials such as the ORS packets. You can also provide soap and clean water. You can also help them by printing education materials that can help them to learn how to practice safe hygiene. You can also provide diagrams on fecal oral transmissions. Under number 5, the implementation of the intervention. On day 1, you can conduct sessions to explain to them what might be causing the diarrhea. You can also explain after they have maybe they are seeing they have signs of the diarrhea, when they should seek for medical help. Or you can also teach them how to prepare and give the oral rehydration solution, the ORS. On day 3, you can also demonstrate for them how to wash their hands safely or how they can handle the water safely. And during day 7, after a week, you can do a follow-up checkup to reinforce the message that you taught during the week. Number 6, on the evaluation of the program effectiveness. Under short-term evaluation, that is between 1 to 2 weeks, you can observe the improvements in their hygiene practices. Maybe they are now washing their hands, they are handling their food properly. You can also ask the patients to demonstrate the preparation of the ORS as you had taught them earlier, or to demonstrate how to wash their hands well. You can also give them quizzes on the causes and prevention of the diarrhea. And you can check whether they are retaining the knowledge, whether they still remember what you taught them, maybe the hand washing, maybe how to prepare the ORS. You can also check whether they have changed their behavior. Maybe now they are boiling their water for drinking. Maybe they are really washing their hands after handling, maybe visiting the toilet, maybe before they handle their foods. And you can also check whether the level of diarrheal episodes has reduced. Under the seventh thing, that is revision of the program as needed. If you check that they have not retained what you had initially taught them, you need to introduce tools like videos, pictures, and also you can increase the health talks. You keep talking to them on the effects. Maybe you insist on how severe the effects of the diarrhea can be. And you can also, if the environmental issues persist, you can collaborate with community health workers to address the issue of sanitation. You provide bins, you provide taps for them to have maybe clean water, and to improve their hygiene. That is all. Thank you.
Thank you. A round of applause for Group 3. Group 4.
My name is Crispin Barasa, the group lead of Group 4, and we just want to discuss about these diarrheal diseases. So you will allow me to use a patient,
Okay.
and I will relate it with the community. Okay.
Yes, yes.
I will begin by the definition of diarrheal disease. Actually, it can be defined as an increase in frequency of bowel movements and water content and the volume of the bowel. And this diarrheal disease may be caused by something like dirty water, actually drinking dirty water or untreated water, increase in alcohol abuse. Actually, we have disagreeable diarrheal intake. We have enteric infections such as viral, bacterial, and parasitic. So, under assessment of needs, I will use a patient. For example, if you enter in the community and you start your assessment, you encounter, for example, you list one patient who has that condition, and you will use him actually to educate other members of the community. So some of the symptoms that can be identified for it, maybe he may be an adult or a child, may have symptoms like abdominal pain, actually cramping, frequency of stool, hyperactive bowel sounds, loss or liquid stools. Yeah, that is under assessment of needs. How we can assess those needs, and we can use this one to educate those people of that community that when you have such a symptoms like abdominal pain, actually when you have a frequency of your stool, they will be able actually to start identifying that this is a certain disease. Next, I'll move for under the diagnosis of the problem. So just the word diagnosis for a nursing care plan, that we actually find what might be the problem. For example, we have identified this patient is having actually a diarrheal disease. Actually, now we move on and see what might be the problem. So when we are under the diagnosis of the problem, we should actually relate it to something, and we move on and provide the evidence. So, for example, for a patient who has actually a diarrheal disease in our community, so some of the diagnosis can be fluid volume deficit, which may be related to fluid loss as evidenced by decreased urine output, dry mucosal membrane, and actually may have an hypotension. So a patient with actually this diarrheal disease in our community he may have actually fluid, his fluid volume actually may be lower because he is losing actually a lot of water through urine or those dry membranes. The next may be imbalanced nutrition, which is may be related to inadequate nutrients absorption as evidenced by unintentional weight loss and muscle wasting. So here in our community, we will actually educate those members of the community to actually to have a balanced nutrition. which may be helping them actually to control, maybe to control some of these diarrheal diseases. Actually, they should take a balanced diet, take those foods that have fibers actually to prevent any to prevent effects such as constipation and more. So another problem that you may be able to isolate, maybe this patient with the diarrheal disease may have an impaired skin integrity, which may be related to frequent low stools as evidenced by redness or irritation around the perineal areas. So actually, what we are able to actually identify as the problems, we can use them to actually educate other members of the community who may not be suffering from that disease, but actually to take precautions that may actually help them to prevent that disease from actually attacking them. So I move to the second one, to the third one, which is development of appropriate goals and objectives. So under development of appropriate goals and objectives, I will keep on using a patient. So when you have such a patient, for example, let me say you have visited a community, you will come up. So you have such a patient, you will actually, what will be your goals and the expected outcomes? For example, for such a patient, you will ensure that within 8 hours of that intervention, actually of that intervention that you have implemented, you will ensure that the patient verbalizes understanding of the diarrheal disease causes and the rational treatment, so that we will ensure that within 24 hours of financing intervention for this patient, you actually ensure that the patient will consume at least 1,500 to 2,000 ml of clear liquid to maintain good skin, targar, and normal weights. This one actually we also use them to actually advise the members of the community to have actually to consume 1,500 to 2,000 ml of clear liquid, which may help them actually to strengthen their immunity so that they may not be attacked by this diarrheal disease, which may be caused by viral bacteria and parasites. So the last one we have for a patient with a diarrheal disease, we ensure that within 24 hours of a nursing intervention, the patient is reestablishes and maintain a normal pattern of bowel function. Note that this diarrheal disease is actually currently now, as I'm talking, it is the third threatening disease that may cause death. So actually educate those brothers and sisters or mothers and grandmothers that are in that community, so that they may help their children and help to evacuate actually this disease of diarrhea. So the next one is actually selection of methods to create an intervention. So some of the methods that you may select, you may have charts. You draw charts there, actually explaining the hand washing process. But the most that I would like to use is actually public education. Here is public education. This is where you actually have an engagement. You call like akamukunji, and then you educate those members of the community the dangerous and how they can prevent these diarrheal diseases. So you can use charts where you can, especially in a hospital setting that may be found in a community, let me say a dispensary. But for me, public education is the most one that can be used to educate those people in that community. Next one is implementation of the intervention. Now we have identified the problem. Where is the problem? Now, what is our intervention and how can we implement them? So, for example, a patient with this diarrheal disease, some of the some of the implementations and actually interventions, maybe you may encourage that patient to take oral rehydration solutions, so that, for example, if a mother, or if a mother has actually a child and is suffering from this diarrheal disease, you may speak to them and encourage them that if your child is suffering from this disease, you should encourage them to take an oral rehydration solution. The second one, you encourage them, or you tell them that they should provide bulk fibers, actually those food that they provide to their children or others in that community, to ensure that it is bulk fibers actually which can help them to prevent constipation. So we have, you give antidiarrheal drugs as ordered. You avoid using medication that slow peristalsis, such as clostridium. You actually have the patient keep a diary of their bowel movements. Next one, in summary, you have evaluation of the program effectiveness. Actually, here is when you report how the patient, how those people or that mother that is having a patient that is suffering from a diarrheal disease, how is it going? If maybe those implementation that is being formulated are not working, you may tell them to actually seek for further medication, or actually change, or have a change of their planning, or actually continue providing those antidihydral drugs, or actually encouraging them to take oral dehydration solutions. And I'll finish by the revision of program.
So group 5.
Okay, I'm going to present the work of Group 5 on Mboga. We're given on the education health plan for patients with who are hypersensitive and smokes. So we're going to start from assessment of needs, because there are 7 steps. So let's start from assessment of needs. You have to assess the health status of the patient, that is from the patient population. So the health status of the patient has hypertension and smokes. Those are, of course, the major cardiovascular. Then from there, we have to assess the lifestyle of that patient. Then we have to evaluate the diet, physical activity of the patient, stress levels, and also smoking habits. From here, the smoking habits, you can assess the duration. When did this patient started smoking? Yeah, things of that kind. Then we have knowledge assessment. You assess the patient if this patient knows or understands what he's suffering from. Then you ask that patient, does he or she understand what is hypertension, and also the risk factors, the risks of smoking, and their readiness to change. If this patient is ready to change, that is knowledge assessment. Step number 2 is diagnosis of the problems. So we have the primary problems. Primary problems which are being caused by people who are hyper what? Who have this hypertension and smokes. Probably we have poor blood pressure, and then we have nicotine dependence because they are smoking. Contributing factors are possible lack of awareness, motivation, support systems, or access to care. Psychosocial aspects, we have stress, habits, or environmental triggers reinforcing smoking behavior. This is, for example, from peer influence, psychosocial aspects. Step 3, I'm going to rush because most of our time is being spent. Step 3 is development of appropriate goals and objectives. So we are going to prepare goals which are going to make for the betterment of this patient. Then goals, we have reduce blood pressure to target levels. You know the normal blood pressure levels. For example, systolic is from I think 80 to 90 to 120. Then diastolic is 60 to 90. Then another goal is achieve smoke cessation. So objectives, most of the objectives are the patient are from patient centered. But now, for example, the patient may choose to have these identify three complications of control hypertension by week 2. Then the patient will participate in a smoking cessation program within 4 weeks. So like these are from the patient. Then the patient will demonstrate correct use of prescribed medications and track blood pressure at home. Yeah, in order to monitor his or her health status. Then step 4 is selection of methods to create an intervention. So here we have two types of methods. We have educational methods and behavioral methods. Educational methods are like one-on-one counseling. This patient undergoes counseling so that he or she may change from that behavior, for example, smoking. Then you may use printed materials on dash that, smoking cessation, a motivational interview to address the ambivalence. So like in short, you are encouraging this patient educationally, I can say like that. Then you use mobile health tools for blood pressure tracking and quit smoking reminders. So like this patient, you have to track his or her blood pressure regularly in order to know how to adjust them. And if maybe, for example, this patient is continuing still smoking, like you can look for the ways to stop that behavior. So we have behavioral methods. Behavioral methods are like goal setting, rewards for smoke-free days. For example, if somebody smokes daily, like every evening, maybe that patient has quit for some days. As a counselor, maybe a medical practitioner, you need to reward this patient, like at least ajione kama amejaribu juu, like smoking is an addiction. So if you reward this patient, I think he may change. Then we have relaxation techniques for stress management. Those are behavioral methods. Yeah, so step 5, we have implementation of the intervention. Those interventions that we made here is that stage now where you implement them. We have session
Let's
plan.
summarize.
Yeah, we have session plan. Week 1, introduction to hypertension and smoking risks. Week 2, nutrition and exercise counseling. Week 3, smoking cessation strategies and support resources. Week 4, we have medication adherence and blood pressure monitoring training. Ongoing weekly follow-up. You follow the health status and condition of this patient. Step 6, evaluation of program effectiveness. We have short-term and long-term. You want to see if the program that you manage or the plan that you made is really working. Short-term quiz or feedback on knowledge gained. Then self-reports on nicotine tests to confirm smoking reduction. Those are short-term. Long-term, we have blood pressure readings compared to baseline. Yeah, then we have reduced smoking frequency or complete cessation, improved lifestyle behaviors, for example, increased physical activity. So the last step is revision of program as needed. So like if smoking continues, we consider nicotine replacement therapy. You may change the program if the plan that you made is not working. Yeah, thank you.
I'm Ocheng Ruben. I will be presenting on action plan for the obese people in the community. So obese is associated with accumulation of fats in the body, making the body to appear huge or large. So on the action plan, we have 7 components where we have assessment, where we gather information concerning the
Under
physical
each,
activity.
just a list. Don't go into explanations.
Okay. So under assessment, you gather information concerning the physical activity of the individuals, the dietary pattern, and the lifestyle of the individuals. Then have diagnosis where we find out the risk factors. So the obese can be associated with hypertension, diabetes, and heart disease. Then the contributing factors include poor diet and lack of exercise. Then have development of goals and objectives. The goals should be, we have an acronym of SMART, whereby they should target the obese people in the community. Then the objectives, we have objectives whereby the individual should acquire knowledge, skills, and a change in attitude. Then selection of intervention, we have workshops. Then we have personalized counseling, we have exercise programs, and you guide on nutrition. Under implementation, you execute the plans, the goals through group sessions, one-on-one coaching, and physical activity. Then you evaluate, whereby you monitor the progress through weight tracking and dietary assignments. So after evaluation, the results you obtain or the feedback, you use it for revision to enhance the effectiveness and the results. Thank you.
Thank you. That is good. Applause for group 7. Group 8 is the same. Eh?
Yeah.
Okay. Then we can go to group 9.
Okay, I'm taking you to health education plan of a mother with a malnourished baby. The first one is needs of assessment. We have purpose to understand the mother's knowledge, attitudes, and practices regarding nutrition and childcare. Methods: interview the mother about feeding practices and health-seeking behavior. Assess house security and access to health services. Review the growth chart. Weight for age, height for age, and dietary intake. Setting goals and objectives. Second one. The goal is to improve the nutritional status of the baby through maternal education and behavior change. Short term, the mother's no proper infant feeding within 1 week. Mid-term, improve the baby's dietary intake and health. Long term, rise the baby's weight and recurrence of malnutrition in developing a plan, educational content. We have importance of exclusive breastfeeding for the first 6 months, introduction of appropriate complementary foods after 6 months, hygiene and safe food preparation, recognizing signs of malnutrition. Approach: we have individual sessions with the mother, use of visual aids, food sample, and practical demonstration. We have number 4, resource identification, human resource, nutritionist, nurse, community health worker, and material resources. We have educational posters, feeding charts, local available nutrition, foods, hygiene supplies. Community resources, we have local health centers, mother support groups, food supplementation programs. Implementation, we have conduct weekly one-on-one sessions with the mother, demonstrate food preparation using locally available resources, provide handouts and visual guides for home use, facilitate group discussion with other mothers for peer learning. Monitoring and evaluation indicators, weekly weight gain of the baby, changes in the mother's feeding practices observed and reported, attendance and participation in sessions. We have tools, growth monitoring charts, pre and post session questionnaires, home visit checklist, feedback and replanning, regular progress with the mother, addressing barriers like food availability, time constraints or misconceptions. And then you modify educational content or method based on feedback, reset goals as needed based on baby's progress. Conclusion, you summarize progress, highlight the baby's improved nutritional status and the mother's enhanced knowledge and practices. Reinforce the importance of continued good practices. Encourage the mother to share her learning with others. Schedule follow-up visit for continued support and prevention. I'm done.
Okay, that is good. Very elaborate. We give a round of applause to Group 9. Okay, great. Group 10.
Okay, good afternoon. I am Cherono Kibet, and I will be taking you through a health education plan for a mother with a malnourished child. The first one is assessment of needs. Collect data on the baby's weight, height, growth chart, dietary intake, and the health history. Then you assess the mother's education on nutrition, hygiene, and breastfeeding practices. Identify socioeconomic factors such as income, food access, and support systems. The second one is the diagnosis of the problems or the problem. You should check on the baby if he or she is underweight for his or her age. Check on the possible lack of knowledge and misconception about the infant nutrition and feeding frequency. You also check on the hygiene practices contributing to frequent infections and poor nutrition. Third, you should develop an appropriate goals and objectives. The goal can be improving the baby's nutrition status within a period of about 3 months. The objectives can be educate the mother on proper breastfeeding and complementary feeding practices. You should increase the daily caloric and nutrition intake. You should also reduce incidence of infection through better hygiene. The fourth step is the selection of methods to create an intervention. Which one can be counseling sessions with visual aids and local food examples. You should demonstrate meal preparation and portion sizes. You should provide a simple feeding schedule chart. Okay, and that is on the selection of methods. Then the fifth step is implementation of the interventions which you develop. The first one is begin a weekly health education sessions, distribute nutrition educational materials, provide referrals to local nutrition programs or food support if needed. Then the final is start growth monitoring and regular checkups. The sixth step is evaluation of the program effectiveness, if the program has been effective or not. First one is monitor the baby's weight and growth within every 2 weeks if possible. Use a checklist to assess the mother's adherence to the recommendation. Conduct brief quizzes or discussion to gauge the mother's understanding of what she has been taught. And the final one is a revision of the program as needed. First one, you should adjust the feeding recommendation based on the baby's progress and tolerance. Second is reinforce or modify education strategies based on mother's learning needs and the feedback. And the final one is include family members in education if additional support is needed at home. And that is my simple presentation.
Thank you. That is very good. A round of applause. So thank you. I'm happy that you have gotten it largely correct. In fact, you've given a lot of details. I think you can compare with what you had. You had more details than what I've put up here. So I think with that, I'm sure you have taken your time to go through the health education notes more deeply. I said the essence is not for you to memorize those, but rather to be able to use them in real world scenarios. And you have done well by demonstrating that knowledge. Any question? We call it a day for today?
Yes.
Okay. Thank you. So, why not? Yeah. Awesome. I wish you a great afternoon. Meet tomorrow.
Same. Have a good day.